everyone, I'm Kora, a speech-language pathologist at Listen and Talk, a specialized program in listening and spoken language for children who are deaf or hard of hearing. Many of the families I work with are concerned. They ask me questions like, is my baby babbling enough? And are they doing all the things that they're supposed to be doing for their age? And to answer those questions, many professionals turn to checklists that have developmental milestones at certain ages. But I've noticed there's a lot of confusion around those lists. Many people don't know how to interpret them. So today I'll answer, what are developmental milestones? And I'll tell you why you should not be too rigid in following them. However, if you do have concerns, I will go over how and why you should seek out an evaluation sooner than later. So what are developmental milestones? They are research-based guidelines for young children's development, typically what 90% of children are able to do at a certain age. So 90%, almost all children, say their first words by 12 up to 15 months. So if your child is in that age range and they are not yet using any meaningful words, then they are in the bottom 10% of children their age when it comes to that developmental milestone of talking. Linked below is a really helpful graph that was developed by the Speech Sisters, which helps show that difference between a developmental milestone, 90% of what children are able to do, versus the average, because it's important to know that they are not the same thing. Keep in mind that each child's growth is individual and will happen at different rates. Some kids are faster and some are slower. But the important thing to keep in mind is that development continues steadily over time. So instead of worrying about how fast or slow your child is able to do something, notice their progress and celebrate all the small steps. For example, if you're worried that your child isn't yet saying any words, think about all the things that have to happen before that first word, like them babbling more and making lots of different consonant sounds. Are they making that progress? Or has it stalled? The mom and pediatrician behind the website, Advice I Give My Friends, cautions parents to stop over-focusing on these developmental milestones. If you are worried that your child is behind where he or she should be, don't panic, get an evaluation. You can start with your pediatrician who might be able to help reassure you, or you can ask for a developmental evaluation which will help give you a full picture of where your child is at. If your child has any factors such as premature birth or a family history of a developmental delay, you might want to involve professionals sooner. Know that these milestones exist so that those who need them can get these helpful services such as speech or occupational therapy. And it can take months to get an evaluation, so that may be a big reason to start this process sooner. Lastly, it's important to remember that you as the parent are the expert on your child. If you feel that there is something not right, trust your gut and bring it to the attention of your pediatrician. Many well-meaning family members, friends, and even other professionals often advise to wait and see, but your child is not too young to be evaluated in your area of concern. An evaluation does not necessarily mean that therapy needs to begin right away, but it will give you a good idea of where your child is at. An evaluation might also give you some strategies and things to begin working on to help your child get to those next steps. Linked below, I've included some helpful information from the CDC on why you should act early and even how you can bring up this important conversation with your pediatrician. I've also included some great resources that I used to put together this video. Thank you for watching. To learn more about Listen and Talk and our services, please visit listentalk.org. And we'll see you again soon.